Hi, I'm Kelly. If you're new to my channel, welcome. This is part of a series that I've been creating about my experience with keratoconus and its treatment options. In the past, I've received a corneal transplant in my right eye, so if you're curious about that experience or some of my experiences with keratoconus before the procedure, I will link those videos in the playlist down in the description box below. This video, however, will be going over some of the general information about cross-linking and the pre-procedure protocol. I will be receiving cross-linking this coming week and wanted to go over with you guys the information that I was given by my doctor. So this might be a good video to reference back to if you have some general questions about cross-linking and even about some treatment options for keratoconus. I'll be going over the pricing for cross-linking. I'll be going over some of the, as I said, pre-procedure protocols, some of the additional treatment options that you can have, and some of the risks with cross-linking. Basically, I'll be reading you the information packet I've been given. So it might be a little bit boring and drawn out, but I will talk about the information that I was given, and then I will go over just some of what I'm feeling before the procedure, and I will do what I've done before in one of my videos, and I will break it into two parts. I will do the technical part of reading this, and then I will break it into how I'm feeling, and then I will leave a timestamp down below. Next, I'm going to give you a general overview of the pre-procedure protocol that I've been given, and then later on in the video I will get into the specifics that are outlined in the packet that I was given. So for me, I was originally going to be part of a research study, but it is now FDA approved, so I am no longer a research participant, I believe. So it doesn't change the fact that insurance does not pay for cross-linking. I'll get into the cost of it later, but so I'm no longer going to be a research participant, I believe. But I was told not to wear contacts for a week prior to the surgery, not to have vitamin C the day before or the day after my procedure. You need to get a examination about qualification for the procedure, and that's just a dilation exam, which I will be receiving this week. But if you're going to have a dilation exam, it can't be done any further past 3 months prior to the procedure. That's weird wording, but basically it needs to be within 3 months prior to the procedure. So you can't have it 6 months before the procedure. So that's the general information that I've been given. I will go over the specifics next. Okay, bear with me because this next part I am just going to be reading over this packet, so it might be very long. I might condense this a little bit, but it's just going to be quite the onslaught of information. So again, I'm not part of a study anymore, so I don't find it necessary to talk about the purpose of the study. Again, is to slow the progression of keratoconus. And it says here that the subjects in the test that's already been done previously have reported a lasting effect. So no progression for 3 to 5 years after the initial treatment. So if you are to receive cross-linking, there's a good chance that you show no progression for at least a few years. So then it goes into some alternative treatments. I've mentioned many of these before in my videos, but this includes contact lenses. There are many different types. There is rigid gas permeable, there's soft contact lenses, there's hybrid lenses, and there's scleral lenses. keratoconus specific contacts can run quite a bit of money. So just bear that in mind. Many of these things can run a bit of money, but I have previously suggested a type of contact and didn't realize how expensive it was until I was told. So I'm just trying to be cognizant of the cost factor in all of this. So contact lenses, Intacts, which are a implant that go in your eye of a hard piece of plastic. At least I'm sure that's what it is. So it is an implantation, but it's meant to stretch out your cornea a little bit so you can see better, hopefully. And then corneal transplant, which I have many videos on if you'd like to watch that. And recently there is a new study being done, and I don't believe it's FDA approved. It's not mentioned in here, but it's called CareFlex. The next part of this packet that I'm going to go over are some of the things that you need to either do or the age you need to be in order to have corneal cross-linking. So this kind of goes over some of the pre-procedure protocol as well in more detail. So you have to be at least 10 years of age, which makes quite a bit of sense. I don't think that keratoconus, I always mix up cross-linking and keratoconus sometimes. So I don't believe keratoconus can be properly diagnosed if you're past a certain age, but I'm not totally 100% sure on that. So take that factoid with a grain of salt. So you have to have a diagnosis of keratoconus, and you have to, as I said, have a dilation exam done beforehand. If you're 32 years of age, you have to have a exam that your keratoconus has progressed within the past 3 years. So the purpose of that is because keratoconus levels out at a certain age for many people, but I'm sure there are some individuals who continue progression even in, even at an older age. So that's just to make sure that your keratoconus hasn't plateaued and that you're not doing an unnecessary procedure. Alright, so on to the contact lenses. This is what it says. You're not allowed to wear contact lenses for the required period of time prior to the screening refraction. So I believe that means even for the tests, even for the dilation and refraction, you shouldn't wear contact lenses prior to that. So I'll give you the times that it's provided. So if you wear soft contact lenses, you're not supposed to wear that 3 days prior. 3 days prior. Soft extended wear contacts, you're not supposed to wear those for a week prior. Soft toric lenses, 2 weeks prior, and rigid gas permeable lenses, 2 weeks prior. And then, of course, you need a signed informed consent. I'm pretty sure you have to do that whether it's a study or just a procedure. It's just part of medical processes. One more note on contact lenses and cross-linking. It says here that you should not wear contact lenses 1 month after until 1 month after cross-linking, and you might need a refitting of contact lenses, which should not be done until 3 months post-op, even though it's not an operation, post-procedure. Next, I will just quickly go over my visit sequence and the follow-up appointments. So for me, I am going in tomorrow to get a dilation exam. I am going in the next day to have cross-linking done, and then I have a 1-day follow-up the following day. After that, it is a 1 week and 3 month follow-up. So I just realized that. Hold on. That's kind of a bummer. I'll mention that a little bit later. Okay, yeah, that's a little bit of a bummer because I'll be visiting family for the holidays. And if I have to do a 1-week follow-up, I can only be at my mom's house for a week. So, I'm kind of bummed. I'll talk about that in the next video. Not the next video, the next section when I talk about my emotional feelings before the procedure. Okay, so a quick note on vitamin C. So you're not supposed to take any multivitamins for a week prior to the procedure, and also you're not supposed to have vitamin C a day before and a day after. So really kind of 3 days, I would think. I don't know. So the day of the procedure, the day before the procedure, and maybe the day after too. Which is kind of hard because vitamin C is in many fruits and veggies. I have a list here. I don't want to bore you by reading a bunch of fruits and veggies, but it makes it a little bit hard. So lots of fruits and peas and onions and tomatoes and even like potato and corn. So finding something to eat is going to be a little bit difficult. But the person who administers, I said that word, administers this procedure said it's really a junk food week. So yay, junk food right before the holidays. So yeah, so no vitamin C a week prior and multivitamins, and then no vitamin C in your food source for a couple of days. Okay, so now we're getting into the fun stuff. We're going to talk about what actually goes into the treatment based on what's given in this packet, and then some of the discomforts and risks. So originally this was going to be a study, so some of this might not be exactly what you will experience. Originally it was going to be a test of timing of the riboflavin drops and what worked better. So it was originally going to be one eye had 2 minutes or every 5 minutes. Actually, so it wasn't just one eye, it was just randomized based on whatever number you were given as a study participant. So it was just a random experiment whether you were going to get 2 minutes, drops every 2 minutes or every 5 minutes. So some of this information may not be necessary to know. So this is what the treatment procedure says. Excuse me, I will be probably looking down for most of this section because I'm reading off of what it says. So it says you will go into your room for treatment, you will be placed in a comfortable position, and you will start receiving numbing drops. Yes, and then generally they wait a few minutes. Once they give you numbing drops, they'll give you numbing drops, wait a few minutes, come back, give you a couple more, and then maybe do that once more. So they space them out and give you a few minutes for it to kick in. So they will do that. They will measure the thickness of your cornea, which generally is like a little poker. It sounds horrible. It's really not that bad. I shake a little bit when they do it, but it's just like a little stick that they use, and you're numbed up before they do it too. But that has maybe a light on it, and then they measure the thickness that way. So they'll do that. And then they use this part sounds scary, so I apologize if this deters you from getting the treatment, but they will use a special instrument to remove the skin covering the surface of your cornea, which sounds scary, but at the same time, my whole cornea has been removed on my right eye. It's just, it makes me think of them like scraping my eye, and that creeps me out just a little bit. So then you will be given riboflavin eye drops, in your eye every 2 minutes for 30 minutes. Okay? Then you will be exposed to a special wavelength of UV lights. Before starting the UV light, the doctor will check the thickness of your cornea again. Okay? So after the riboflavin drops for 30 minutes, your doctor will again check the thickness of your cornea. So it says depending on how thick your cornea is, a riboflavin soaked contact lens might be placed in your eye to ensure adequate depth of riboflavin to protect the back of your cornea before starting the UV light. Okay. During the light treatment, your eye will be held open with a special instrument called a speculum. Okay, so a speculum is just, they kind of look like eyelash curlers in my opinion, and it just holds your eyelid open. Pretty common in these things. I had it for the transplant, I had it for a relaxation incision, and now this. So, pretty common. You will also receive more riboflavin drops during the light treatment. So, as I said, it's either every 2 minutes or every 5 minutes. I don't know. It's no longer a study, so it shouldn't be randomized. But I'm not sure if I was given, sorry for flipping all my papers everywhere. I'm not sure if I was given the exact, no, I wasn't given the amount of time that you do it. Based on my knowledge, it's either 2 minutes or 5 minutes that you receive riboflavin drops during the light exposure. You're supposed to keep your eye fixed on a central light as best you can, and you shouldn't worry if there's some movement of your eye. And then it will, if you had the contact lens put in your eye, it will be removed. You will get a bandaged contact that you will wear, much like the corneal transplant, that will be removed a week following when you go back for your follow-up exam. You'll need someone to drive you. It will probably hurt for a few days, and it's normal. And basically they said if you get it done in both eyes, you'll have the symptoms in both eyes. So if you have both eyes done in cross-linking, you'll probably experience a little bit of pain and blurriness in both eyes, which makes total sense. So again, make sure you have someone to drive you home because you won't really be able to. Okay, in the next section I will discuss risks of the treatment. I'll probably just go over the common risks because, first of all, I don't want to freak anyone out with the uncommon risks. If you really want to know, I can possibly do a video where I discuss all of them, but I'm going to just go over some of the common risks and discomforts that might occur. Now I will discuss the common risks and discomforts of corneal cross-linking, and I'm just going to go over the common risks and discomforts, not the uncommon or rare ones. As I said before, I don't want to freak anyone out, and really most people experience the common ones. If you want me to later on read out the uncommon and rare discomforts and risks, I can do that. So for the epithelial removal, the first part of the procedure, well, aside from the numbing drops and all of that, you will feel maybe some pain. You will take some eye drops and take pain medication by mouth if needed to help with this. Blurred vision that lasts for a few days is a common risk and discomfort. The riboflavin drops might cause blurred vision, mild redness, or stinging of your eyes for a few days. The UV light really is the same side effects. With the numbing drops, it might cause tearing or stinging redness of the eyes, and same across the board really. So dilating eye drops, I'm sure you guys understand how that is, but it will maybe cause glare, blurry vision, redness, stinging, and trouble reading distance for up to 6 hours. So that's pretty common. Basically, the symptoms are pretty much the same across the board. Redness, stinging, maybe some tearing of the eyes, blurred vision, maybe a little glare. Of course, if you have allergic reactions, you might have some redness of the eye or a skin rash. And then with prescription medication, I don't know if, maybe I already read this, if you use prescription pain meds afterwards, it can cause nausea, vomiting, constipation, lightheadedness, dizziness, drowsiness, flushing, my Midwest just came out. Vision changes or mental or mood changes, which are common side effects for any sort of medication, but in specifics, prescription pain meds. So, the last thing that I believe I need to discuss on this paper is the cost. It originally was, I believe, $2,000 an eye. Now it's $1,500 an eye. So, $1,500 US for one eye for crosslinking. Okay, so that's all of the general information that I was given for the pre-procedure protocol. In the next segments, I will add a timestamp and begin discussing just how I'm feeling before the procedure, and yeah, that's pretty much it. How I'm feeling about the procedure, some of the emotional impact that it's had on me. Okay, don't mind the scenery change and my outfit change, and I might be a little bit cross-eyed in this clip. I am a couple of days out from the procedure. I'm going to be making another video just talking about how the procedure was, and then probably another video after that about post-procedure tips and tricks, because I feel like not everybody might know these things. So I will make a separate video on that, and that will include post-procedure tips and tricks for both the cross-linking and the transplant. I was going to add a emotional side of things before the cross-linking to this video, but in all honesty, I was just having a really off day on that video and was just really bummed out. So in short, I was feeling a little bit upset. I had found out that I had to be back to where I live in Indiana for this procedure, which cuts my holiday time with my mom and my sister a little bit short. Luckily, that has changed a little bit, and I can talk about that in the next video, or I can cover it here. So basically, I was able to move the appointment back just a couple days, so I get a couple days extra, which is nice. Other than that, I've found out some other news about my transplant eye, and I might make a separate video on that too. It won't be very long, it's just a little quick update and how I'm feeling about that. So that being said, I'm going to make the next video here very quickly, just outlining my experience with the procedure, and then maybe today or maybe in a couple days after the holidays I will make the tips and tricks video. I apologize because these will probably not be up until after the holidays, just because I'm really not even supposed to be looking at a computer right now. So yeah, that being said, I will see you in the next video. Bye.